Good afternoon and welcome to Coping with COVID. I'm Tre Tailor. We've got updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you in part by SCDHEC, Healthy Families, Healthy Communities, and the City of Columbia Office of Business Opportunities, helping small minority and women-owned businesses in Columbia, South Carolina. Dr. Alexia Gaffney joins us again from New York City. She's a triple
Hey.
board-certified infectious disease specialist in our own South Carolina's own board-certified family physician, Dr. Nicole Edwards, joins us. Ladies, thank you so much for joining us once again on Coping with COVID.
Thank you. It's good
Thanks
to
for
be here
having me
again.
on.
Absolutely. We're going to come right back with these beautiful ladies and talk more about the concerns and updates surrounding COVID-19. But first, here are your COVID community updates. All right, SCDHEC and Prisma are continuing their ongoing COVID testing. For the most up-to-date list, please log on to scdhec.gov and prismahealth.org for locations, times, and information for daily testings. Now, if you live in Richland or Clarendon County, you can actually call 911 Monday through Friday from 9 a.m. until 5 p.m. and get up-to-dates on COVID testing. Now, there are several test sites going on the next couple of days. At Brooklyn Baptist Church, they're testing in West Columbia through 3 o'clock today. Today through Thursday from 10 a.m. until 4 p.m., they're testing at the State Fairgrounds. Now, you do need an appointment for that. You can go to krogerhealth.com/COVID-19 testing. That's today through Thursday from 10 a.m. until 4 p.m. Now, on Friday and Saturday in Columbia, South Carolina, they'll do free testing at the Benedict College Stadium from 10 a.m. until 2 p.m. Also, the election runoffs are next Tuesday. That's right. It's still election time in South Carolina. Early voting is still available. So stop by your local voter registration office in Columbia. That's at 2020 Hampton Street. You can do that weekdays from 8:30 a.m. until 5 o'clock p.m. Poll workers are also still needed. So please find out where the voter registration office is in your city or town, and please sign up to be a poll volunteer. I'm Tre Tailor, and you're watching Coping with COVID. Once again, it's brought to you in part by SCDHEC and the City of Columbia Office of Business Opportunities. Dr. Alexia Gaffney joins us from New York City, and also Dr. Nicole Edwards from South Carolina. Last week, ladies, I saw on the Today Show where the World Health Organization mentioned that you are no longer contagious if you don't have symptoms. I immediately picked up the phone and texted Nicole and said, "Did you hear this? We got to do a show on this." And Nicole gave me the look through the phone, Alexia, that she has on her face, like, I saw that through the phone. So I immediately wanted to get you back on, get Nicole back on to kind of talk about it, because as we've said before, it's constant updates, it's constant information, because again, this is still a very new disease. So let's talk about that first, because actually, after the World Health Organization said that, Dr. Fauci did come back and say, hold up, wait a minute.
Mm-hmm.
So tell us about that, asymptomatic or pre-symptomatic, because
Right.
you could be asymptomatic, which means you have no symptoms, but you don't have any symptoms until you have them.
Exactly.
You know?
Exactly. It's like nothing's wrong until there is something wrong.
Right.
So what they were trying to say is that they felt that people who were pre-symptomatic, so not having symptoms, carrying the virus, and ultimately turned out to become people who were sick, seemed to be more likely to spread the infection than people who just were asymptomatic and remained asymptomatic. So totally without symptoms, never developed symptoms, subsequently tested negative. Maybe those people were more likely to be spreading the infection than the folks who never developed symptoms.
Mhm.
But there's no reason to believe that someone who is carrying the virus can't cough it or sneeze it out, or because we still cough for other reasons. Again, we're always talking about the virus being airborne. We're talking about respiratory droplet spread in this virus. So speaking, laughing, so many other things can cause you to breathe the virus out onto people, hence why we're all in mask and why we need to maintain the minimum of 6 feet of social distancing.
Yeah.
So symptoms or not, the possibility is always there. But I think what they were really trying to say is that the pre-symptomatic people during the time frame where they had no symptoms were the bigger culprits in spreading the virus, but
Gotcha.
nothing is absolute, and even, it's like common things being common. So this symptomatic people or pre-symptomatic people may be those who are spreading the most infection. It doesn't mean that there's zero spread from asymptomatic people.
Gotcha. Want to say hi to Willette Wooten. She says, God bless you and yours. So that's me and all of y'all. Thank
Oh,
you so
thank
much for
you.
joining us on
Thank
Coping
you.
with COVID. Please continue to post and share this information out. We're talking to triple board certified infectious disease specialist, Dr. Alexia Gaffney. She practices in New York, and also board certified family physician, Dr. Nicole Edwards. And we are trying to debunk some of the myths and some of the information that has come out about COVID recently. So basically, ladies, no matter what, because again, from day to day, if we're leaving out of our house and not, we are susceptible to one, getting it. So two, whether we feel like we have any symptoms or not, we've got to be conscientious about how we go about our day.
Absolutely. I mean, you have to assume if you've been out of your house and you've been in contact with other people for whatever reason, that there's a possibility you may be carrying it and not knowing, and that the people you encounter may be carrying it and not know it. So you can't just have it that, oh, well, I'm going to meet up with my friend and not take precautions because she hasn't left the house and I haven't left the house. Well, did you go to the grocery store? Did you go to the pharmacy? Did you gas up your car? Those are all potential points of exposure. And just because you're not having symptoms now and no one said you have COVID doesn't mean that you won't pop up with symptoms 2 or 3 days from now or 2 weeks from now. And so if you're going to meet up with people, the rule is less than 10. I wouldn't even approach 10 people,
Really?
And you have to maintain the distance. I had a birthday celebration with girlfriends. We were literally 10 or more feet apart from one another on a patio outside, and when I had to use the bathroom, I was like, all right, gotta go to the bathroom. I'm out. I'm not going in her home.
Right.
Because her husband goes to work and she's doing the grocery shopping for their family. I go to work every day. I do the grocery shopping and the pharmacy runs for my family. So if I didn't go in her bathroom and pick something up, I don't want to take anything in there and leave it, know?
Right.
And so, I arrived with a mask on until I saw how we would be situated. We were many, many feet apart from one another. So I took it off to chat at a great distance. But, I would be very hesitant to do more than that. My patients are reporting they see, bars full of people.
Yes.
People eating in the outdoor space of restaurants. And, the tables are barely 6 feet apart. The 2 people are like 2 feet from one another. Is that the person you live in the house with? Or is that somebody you came from another household and y'all got together at this outdoor restaurant? Now y'all are going to eat and talk and chew and drink and laugh 2 feet apart from one another. It's just because it's outside doesn't mean it's safe. You still have to maintain that distance and you still have to wear your face mask. So, people are getting tired. People are getting complacent. It's old news and we're going to be in big trouble.
Yeah. Tiffany Myers says she appreciates the candid information and details from actual medical professionals. She says, thank you, ladies. Hey, thank you, Tiffany, so much for watching. Yeah, definitely. And please continue to post and share this information out. And you're right, Alexia and Nicole, please feel free to jump in at any time. If people are getting very relaxed because states are opening back up. And, when you say you can go to a restaurant just as long as you're outside, people think, okay, as long as I'm outside, I can go to a restaurant. But you made so many great points. Well, okay, you're outside. What about if you're outside, but then you're still with 5 other people, 5 other people that came from 5 different households?
Yep.
So
it's increasing the likelihood of exposure at that point.
I think people are, like you said, people are getting tired, and I think people are trying to grab any little bit of hope. And I think that was kind of the concern when the World Health Organization came out and said that. Then everybody was like, "Oh, that's it, it's over."
Right?
No, and I think honestly that was actually kind of dangerous that they. And I'm glad that they retracted that next day.
But it was already out there.
People already heard what they wanted to hear, which was like, "Oh, I don't have symptoms. I'm going out to party." right? And that's not, I mean, and we all know this. That's why they tell you 2 weeks of quarantine, because it might take 2 weeks for you to get symptoms, right? And so I think that was, like I said, that was kind of dangerous for that to be out there, because like I said, people hear what they want to hear. But I think people are just, they're looking for any grasp to be able to get back to normalcy, when I think what we need to really do at this point is to accept that this is our new normal right now. And we don't know how long it's going to be the normal. And so we need to deal with it. Like, just let's deal with it.
We just have to make the adjustment. The more you're in the practice of doing it, the less tiresome, the less exhausting, the less stressful it becomes. And we just have to stop being so resistant to it. It just makes it that much harder when you're resisting this thing, because it's not going anywhere.
Right. Yeah. Thank you, ladies. Michelle Keir says what you just said, Nicole, as a matter of fact. So wearing masks and social distancing should be the new normal regardless. She says, is this the only thing that will safeguard you and others from catching the virus?
Yeah. Right. The social distancing, wearing the mask, good hand hygiene, trying not to touch your face. The rules haven't changed,
and won't change for a long time.
Yeah. So what is a long time? Is a long time through the end of the year? What
Longer
is a long
than that.
Really, Alexia? Wow.
So the vast majority of the population is still susceptible to this virus, and the virus is still out there. And the more people who have the virus that are mixing in with people who are susceptible, the more likely the numbers are to go up. So we're more likely going to see an increase in the numbers as opposed to see a decrease in the numbers, especially because the way in which many states opened, we opened with still lots of virus out there in our respective communities. And now all of the folks who have the virus don't know they have it, know they have it, and don't really care, because there's people like that out there. We've known that since the beginning of this pandemic.
And that's bizarre to me. Someone just told me today that their son-in-law caught COVID because his coworker came to work knowing he had the virus.
Yeah.
How irresponsible can someone be? And I guess people are irresponsible because, as you said, people are so resistant to even putting on a mask.
Yeah, or they just don't believe the hype, or it's a conspiracy. People just they're like choosing a side. I'm here with the conspiracy theorists, I'm over here with the science and the facts. I'm relying on my faith without using any wisdom or discernment. Like, there's a whole bunch of layers to why people are behaving the way that they are around this. And then, there's a whole issue about the leadership and the way things have been presented to the public that's causing a lot of doubt for people. So some of it is understandable, but, it's just like, why not just err on the side of caution? If you really just don't believe it, we're no longer in a time and place with this thing where people are not aware of someone who's gotten critically ill or died from this infection. We all know somebody at this point. Although I didn't understand to the point where I would behave in the way that people who are just totally non-believers in this would behave, I can understand why somebody would believe there's a possibility this is not real. I don't know anybody who has it. Nobody in my community has it, but it's touched every state. It's touched most counties and cities all throughout the country. And now everyone knows or has lost someone to this infection, or has had someone hospitalized or sick from this infection. So now it's like, okay, it's undeniable. It's here. Let's just do the right thing so we can move on from it. But we're not going to move on from it anytime soon. The 1918 Spanish flu, which is probably the closest thing that we can think of that resembles this, it took 2 years for that to peter out. And they had major peaks or spikes in the virus outbreak over the course of time that pandemic ran on. So even everybody is hopeful that a vaccine will be produced and be successful, but it takes a year to reproduce a flu vaccine. And we know exactly what we're doing when we make flu vaccines, and it still takes a year to get the next season's batch. So we have to go through all the testing. We have to prove that the vaccine works and is efficacious. We have to prove that it's safe, and then we can produce it. And we're not anywhere near that. There's some promising prospects, but we're not going to have a vaccine next week. This is not producing pills. This is not reproducing or revving up the production of things that already exist. Like, nobody can pivot a business like we did with masks, for instance, and personal protective equipment. We can't produce vaccines in that way. So we've got a long time to go before we can just mass vaccinate folks. So we got to just be careful.
Yeah. Dr. Alexia Gaffney is a triple board certified infectious disease specialist. She practices in New York. And Dr. Nicole Edwards is a board certified family physician from here in Columbia, South Carolina. I'm Tre Tailor. Thank you so much for joining us on Coping with COVID. It's brought to you in part by SCDHEC and also the City of Columbia Office of Business Opportunities. Hey, Keisha Taylor wants to know, is it safe to go to her doctor's appointment?
Yes.
Absolutely. Absolutely. With precautions. So you need to also check with your doctor's appointment, check your doctor's office to find out what their rules are. For example, my rule for my office, there is no waiting room. So your waiting room is in your car. You can either text or call when you get here, and I will come out to meet you. When you come in, you have to have a mask on. And you don't touch anything as you walk back to the exam room. Everything happens in the exam room, your vitals, everything. And then when you're done, I escort you right back out to your car. Like, there's no stuff. So lab, everything's done right there in one room. So you're not touching anything. You're not touching any surfaces. You sit on, that one chair. And so you just need to find out what your doctor's rules are. But yes, please go to your doctor's appointments. Everyone needs to go to your doctor's appointments. Please go to your doctor's appointments.
Absolutely. You said it.
Yeah, is that it? Okay. So, and then in between, you're sanitizing, right? In between your patients?
Disinfecting all surfaces, anything the patient would touch or sit on. If we use a blood pressure cuff, and we tend to put them on the counters, so we're disinfecting the blood pressure cuffs and the counter surface that it was sitting on and will be sitting on before the next patient comes in. And it takes a longer time to turn over the rooms because we disinfected the exam table before, not the chair and the arms of the chair and every single surface of the countertop and the doorknobs and all of those. Like, we didn't do that. That would have been done at the end of the day, but now it has to happen every time that room turns over. It takes a lot longer to get people more safely in and out of rooms. So when you do get to your doctor's office, please be patient and just be mindful that they're trying to not just take good medical care of you, but to just make sure that they're creating and keeping an environment that's safe and healthy for you. We don't want you to pick up things that you didn't walk into the office with.
Right. Marvell Williams Mendenhall says, good afternoon, ladies. Thank you all for keeping us informed. And Superior Edwards says he can't wait to see his doctor.
Oh,
Then that's it. This is Nicole's husband, everyone. Thank you, Superior, for watching. Okay, so here's another thing I wanted to ask you all about is, what about blood type? Now, a couple of weeks ago, we did a show. I'm not sure. I think I had one of the physicians with Palmetto Health, Prisma, and one of the listeners, viewers asked, does blood type have anything to do with catching COVID? And then a couple of days later, I read an article that says there are certain blood types that are more susceptible. You guys say what?
And we all have a upper and a lower respiratory tract, and the virus has its affinity to the cells in the respiratory tract. Now, could it be possible that based on your blood type, you have a different immune response? Because a lot of the symptoms and the complications of the infection, once the infection settles in, is immune mediated. So could it be possible that some people are more prone to have a more robust immune response? Quite possible, but we don't know people's blood types per se when they're hospitalized, but we know their risk factors. So we know if they're obese or not. We know if they're hypertensive, if they're diabetic, pre-diabetic, if they have chronic kidney disease, if they have other immunosuppressed states, and we know how those types of risk factors play out. So, if you're not someone who's in a state of general health and wellness, then take this as the opportunity to start exercising, to start eating healthier, to start taking vitamins and nutritional supplements that support your immune system. It's much bigger than, okay, I got the sniffles today, I'm worried, is it COVID, so now I'm going to take some emergency. No, you should already be taking a vitamin C supplement or eating citrus fruits. You should already be taking a zinc supplement. You should already be eating foods that are high in antioxidants. You should already be eating an anti-inflammatory diet for your general health and well-being, and hopefully your body is more equipped to fight and not have an unhealthy, exaggerated response.
Right.
If we, God forbid, come down with COVID or any other infection. We will be right back into cough, cold, and flu season in 3 months. And so we've got to brace ourselves for that and COVID on top of it.
Yeah, you make such a great point, Dr. Alexia, because just because we're dealing with COVID doesn't mean everything else stops. We're
Everything
still
else is still on the table.
Yeah, we're still got to go to, like you said, cough and cold season, seasonal allergies, all of that on top of COVID.
Yeah.
So as you say, we've got to be so much more conscientious about our health. We talked to a dietitian yesterday on coping with COVID about how what you eat affects everything. So if you're not, and Nicole mentioned this a couple of weeks ago, if you are already starting with a compromised body, if you already have diabetes, high blood pressure, whatever, and then you hit with this, your body's not able to deal with anything else that you bring at it.
Right.
Yeah. No, Gwethlyn Barnes wanted to ask a question about the doctor's office. She said, should everyone in the doctor's office wear a mask, especially the staff? She said she was in an infusion room and other patients did not have on masks and they were very talkative.
Yeah, they should absolutely have on masks. You can talk and be heard through a mask. I've been a patient in a treatment situation where it required me to be in an infusion center, and you can be there for hours. So certainly nobody expects you to sit there silently, and not all infusion centers or suites are set up where there's single rooms, but patients can be appropriately distanced from one another, and they should be encouraged by the staff to put their mask on, and all of the staff should have mask on. So if I were you and I was sitting there and those folks were potentially exposing me, I would grab a nurse, I'd ask to speak to the manager, and I would insist that those patients be made to cover their faces.
Absolutely.
Dr. Alexia Gaffney has joined us on Coping with COVID. She's a triple board certified infectious disease specialist. She practices in New York. Dr. Nicole Edwards practices here in Columbia, South Carolina, where Coping with COVID is based. She's a board certified family physician, and you are watching Coping with COVID. I'm Tre Tailor. Thank you, everyone, for watching. Please continue to post and share this great information out, and we certainly do appreciate you watching. Dina Marie asked what we just talked about. She wants to know, why are those that are diagnosed with diabetes at such a big risk?
It's those with diabetes, those with any kind of cardiovascular disease, so hypertension and any type of lung disease, right? So basically, when your body is already trying to deal with those conditions, to keep your blood pressure down, to keep your sugars down, to keep your lungs working, so your body is already dealing with that. Then you put COVID on top of that, it means that you're already starting at a deficit. Okay, so if you think of it like a container, we'll just go back to my container. So if you are starting at 100, you have it all, right? But if you are starting, if you have diabetes, so you're already starting 50%, and then that's why, because your body's already trying to take care of
the diabetes
conditions that it's already working for. And then, so if you put a condition on top of that, then it makes it even worse.
Yeah. The way COVID impacts the body is like nothing any of us have ever seen before. Where diabetes affects all systems of the body. It affects your kidneys, it affects your liver, it affects your heart, it affects your blood vessels. It affects the blood vessels going to the brain, right? It's a risk factor for heart attack and stroke. And then so does COVID. COVID affects the lungs. We're seeing people have abnormal heart rhythms and heart attacks. We're seeing people have blood clots in the legs, having strokes. And so diabetes is already compromising all of those symptoms, but kind of at a low smoldering level where the body can tolerate it. So think about like, I don't know, a fire, right? A fire in a fireplace or a fire pit, and you kind of have little smoldering, but it's not really putting out any heat. You can't cook any s'mores on it, but somebody runs over and that somebody is COVID, and they just start like spraying lighter fluid all over everything. Everything goes up in flames very quickly. That's how I see diabetes and COVID on top of that. It's like you're already in a smoldering state. And here I come with just dousing an accelerant on it, and now the whole body's up in flames.
Yeah, that's good. That's good. Thank you, Dina. I hope that answered your question. So basically, you're already ill. Whomever, you already got something.
You might feel good. You might look good. Nothing's really bothering you, and that's why we call things like high blood pressure and diabetes, pre-diabetes, silent killers, because you're good until you're not.
No, you're not. Yeah, you're good until you're not. Yeah. One more question, Alexia, because I know you've got to go because you're a really doctor in real life out here in these streets. Keisha Taylor wants to know, how should you sanitize your belongings, such as your phones, your purse, etc.? Some people are not doing this.
Yeah. So our phone, think about it, right? How many times you have no choice but to touch things, right? You're touching your face. You're touching the door handles on your car, doorknobs when you're coming and going. You're picking up things at the grocery store. And we use our phones for everything, to process payments, to we're calling people. We keep our list in there. We're checking the time. We touch our phone hundreds of times a day. And every time you touch it, if you're not dropping COVID, you're dropping some other virus or some other bacteria or mold or whatever is in the environment. We sit it on countertops everywhere. I've been guilty of this. I keep going to the grocery store, I'm digging for my card or trying to move my keys out of the way, and I sit them right on that counter where everybody else has touched it. So actually, when I come from the grocery store or the pharmacy, because I know I touch my phone when I'm in there, I'm using hand sanitizer and a paper towel to clean my phone. If I'm home, then I'll use the disinfectant wipes to clean it. And I try to get in like the little creases. So I take it out of the phone case and wipe it down. And you'd be shocked like how sticky and how much junk is up underneath your phone case on the surface of your phone. So like those are like the hidden invisible germs that are on our hands and all over everything we touch. So just I would do it at least once or twice a day. I don't talk on my phone, like put it up to my face anyway. I would get headsets and clean them off, or I would just use the phone on speakerphone, but I would not be putting my cell phone to my face if I'm someone who is putting it on different surfaces because I'm still get to go to work every day, or I'm the one who's going to the grocery store or the pharmacy for my family. Did I sit it on the counter, or did I touch a bunch of stuff and pick up my phone and now I'm going to sit it on my face? We have to rethink the whole way we use it. And then the same thing with purses, like dump them out, wipe the surfaces of them with disinfectant wipes. If it's leather, then, treat it, condition it after the fact, wipe the insides. I've been using bags that I don't necessarily love. I've been using I have a tote bag that's kind of made of like a sweatshirt material. So I can just throw it in the washing machine.
Mm-hmm.
Yeah. Or not carry a purse at all. So that's what I've been doing.
Bare minimum.
Right. So for example, we talked about going to an infusion center, which I have to do every month. So when I go in there, I have my mask on. My phone is in my pocket. My Bluetooth is already in my ear. So that way, if somebody calls me, I can just touch that without touching the phone. Mm-hmm. I take my, that place doesn't even ask for my insurance card anymore because I already have it. And my license and my bank card, and I put it into my pocket. Other than that, I'm not walking in there with anything else. Same thing. If I do have to go somewhere, my husband don't let me go to no stores anyway, but if I ever did, I don't carry anything in. But so like I said, my bank card, everything is already in. And then if possible, I'm, paying with some kind of non-touching device if I can, but I don't even carry anything if you don't have to.
Yeah.
Like just that, because that limits how much stuff you're touching and how much germs you're getting. And then make sure that you are really wiping it down or sanitizing it when you do get out or you get home.
Yeah, those are like the little hidden places. I mean, Alexia mentioned, how much is inside your phone case. You don't even think about that. If it was any normal time, you'd open it up and you do say, gosh, how did all of this get in there? And those are the times when we think, oh, I wasn't with anybody, or I didn't do this, I didn't do that. How did I get sick? It's those hidden things, those things that we don't even think about. The phones, your purses, things like that. Alexia, I know you've got to go, but before you leave, I know there were a couple of things that you wanted to share with us. So can you tell us those things?
Yeah,
please?
absolutely. So at the beginning, I just said, don't get tired, don't get fatigued. Just stay vigilant. I know it's hot, but please do continue to wear your mask, continue to eat well, continue to exercise, definitely get out, get active, get some sunshine and some fresh air. Just do it at least 6 feet away from other people. I know everybody's excited because the economy is opening up. I saw, people who were supposed to be socially distanced in an amusement park, and the people were just all on top of each other. Now is not the time for that. I know it's summer, I know it's vacation, and we want to get active, but again, stay vigilant. A lot of parents, myself included, were contemplating if they're sending their children to camp. I personally am not. I'm not willing to take the risk that someone else, because they have to go to work, wouldn't send their child to camp, with some sniffles and dismiss it as allergies or assume that it's not COVID, or just not even care because they got to go to work and they have things to do. I don't trust camp counselors who are largely teenagers and doing what they want to do, including congregating with one another to take care of my child all day. And I don't trust another organization to disinfect playground equipment between every single camper that's been on it, so there's hard, fast rules that the CDC has laid out. And I think, there are some of us who absolutely have no option but to utilize camps and daycare. So I encourage parents who are utilizing those services, because they have no other choice, to inquire, see if they're following the CDC guidelines. But if you don't have to, I would really second guess or really reconsider if that's what you're doing this summer. And I'm just waiting to see how things play out for the school year. So just be safe, be vigilant, and stay healthy. And I'll see y'all the next go around.
Dr. Alexia Gaffney, triple board certified infectious disease specialist from New York. Thank you so much once again, beautiful,
so much for
joining us on Coping with COVID. Nicole is going to stay with us. We're going to tell Alexia bye and have a good afternoon.
Have a great one.
Thank you. Thank you so much. And we're going to come back with you, Nicole, and more of your questions right after this message from our sponsors. Coping with COVID is sponsored by the South Carolina Department of Health and Environmental Control. Please look at the scroll on the bottom of the screen where there are up-to-date listings on COVID testing sites. Go to scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and your friends from the coronavirus. SCDHEC, healthy people, healthy communities. Coping with COVID is also brought to you by the City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in Columbia, South Carolina. Check out their series of Back to Basics financial webinars, the first one being this Wednesday. It's called Bookkeeping Boot Camp with Anthony and Hamilton Grant. Visit eventbrite.com and search OBO, Office of Business Opportunities, for more information and to register for the webinar. Coping with COVID, again, is brought to you in part by SCDHEC, Healthy Families, Healthy Communities, and the Office of Business Opportunities for the City of Columbia, helping meet the needs of small, minority, and women-owned businesses. I'm Tre Tailor. You're watching Coping with COVID. Dr. Nicole Edwards rejoins us as we continue to talk about updates and information on the coronavirus. Dina Marie says, thank you so much for that information. She was the sister with the diabetes. She said that was such a great analogy. She said she's insulin dependent. Nicole. So you are really at risk, Dina. You're really at risk. So please take care of yourself and just stay inside. I know Nicole and I were talking earlier today about about the marches and the protesting going on, and there's so much I really wanted to go, and I've got two little ones and wanted to take the babies, but I had to think about, I'm you know it's too many folks, and
Mhm.
so here we can support from where we are,
Yeah.
by doing whatever we can do. And I definitely support them. I've had several of them on my show, but we have to shift our thought process, Nicole.
Right, right. So everything is now becoming. There's a saying out there. I can't think of exactly what it is, but it's not always about what happens to us, but it's about how you deal with what
Yeah,
happens to you. And so I think now we're having to change. It's a whole paradigm shift of how are you adjusting to this new normal. I think a lot of us are like, just, oh, I don't want to wear the mask, and okay,
yeah.
well, deal with it. We need to, right?
Yeah,
You might not be able to go out and party like you used to. Deal with it, right? And you got to figure out new ways to make it work for you.
yeah.
Whether that's doing your birthday parties online, or doing the drive-throughs for your kids' parties, or you just got to find the new ways to make this work for now. I think that's the other thing, is that people are so quick to try and let's hurry up and get back to how things work. But let's be honest, were things really that good? Okay, we're not gonna talk about that. But
Mhm.
let's move to something better. But we have to, don't be in a rush, right? If we could just hold still just a little while longer, like you talked about before. A lot of times, I think a lot of states and countries in general, we kind of moved hastily to try and get back to opening and get back to, but we didn't even follow the guidelines, which were 2 weeks of numbers going down.
Right.
I don't think any state actually did that before they opened, and now people are like, oh, are we in round two? We're not in round two. We're still in round one, but
Right.
yet we're still seeing, what is it? I think there were 7 states that have almost doubled their numbers in the past week, and there was at least 14 states that still getting new cases of
And
numbers.
South Carolina was one of those states.
Was one of those 7. I know. Wasn't
Yeah.
that wonderful? Yes, yes. But we've seen our highest numbers. Saturday, we saw 799 new cases.
Mm.
And they're actually looking at, because at first I was like, okay, maybe it's because we are finally testing more.
And that's what I thought too,
Thankfully,
Nicole. I felt like,
we
okay, we're testing more, so of course we're going to get more numbers.
Exactly, but they're actually looking at the percentage of positive tests, not just the number of positive tests. And the percentage of positive tests is actually also going up, which means that even though we're testing more, there are more people who are testing positive, not just because we're testing more, but because there are more people that actually have the condition. And so that's scary, y'all. This has been, in South Carolina, this is our highest numbers since we've been dealing with coronavirus since March. And so 799 new cases per day, that's scary. That's very scary. Even down on like places like Florida, they're getting 2,000 new cases a day. Come on, y'all. We got to do better.
Now, do you think that does have a lot to do with, Nicole, the fact that states are opening back up and people are kind of hanging out and closing in on people? More people are getting infected because,
Exactly.
yeah.
Exactly. And I think it's because, just what Dr. Alexia was saying, we've gotten weary in our
Mhm.
well-doing. When this first came out, everybody was, okay, we're going to stay at home. And we had, at that time, mandatory stay at home. There was nobody on the highway. It was kind of
Right.
great to have to drive in. Everybody was doing, tele everything, right? Nobody was going out. You ordered all your food online. But now that we're open back up and people are out, we went out to get ice cream the other day. There was 24 people in the little ice cream place. I was kind of scared about that. Out of those 24, the only 4 people that had on masks were me, my husband, and my 2 kids. And the workers didn't even have on masks, which would kind of concern me, because I'm like, you breathing on my ice cream, and where's your mask? Like,
Yeah.
and all these places are supposed to have these mandatory orders, if you're going to be inside, you have to wear a mask, and yet nobody's doing it. I think we've gotten weary, like I said, in the well-doing, and so people are becoming more lax, and now we're running into the problems where now we're infecting more people.
Right, right. Alexia mentioned something before we got off the air about recovery, that a lot of people too are making the mistake of, after they've quarantined and they feel better, they're back out maybe too soon and not doing what they're supposed to do.
Right. And honestly, that's kind of a hard thing to figure out, because if you, depending on which guidelines you're looking at, every single person has a different guideline. Some people are saying you need to be 3 days, without a fever before you go back out. Some people are saying a week before you go back out. Some people are saying you need to wait the full 2 weeks before you go back out. And so who do you listen to, right? Again, this is the novel coronavirus, so this is new. None of us know exactly how to deal with this or what we're doing with it exactly, because this is new for us. But really, yes, people are going out too soon. And just because you're asymptomatic, now I know even that 3-day guideline was because sometimes you can feel better and then all of a sudden you can spike again, right?
Mm-hmm.
And then even, I think we've talked about this before, businesses and things are checking your temperature before you go in. But you might go in and you might be asymptomatic or without a temperature or afebrile right then, but it doesn't mean that 2 hours ago you didn't have a fever, or later on tonight you might spike the fever, or maybe last night you had the fever but you don't right now. And so I think a lot of places, because we're trying to get back to normal so quickly, that we're moving a little bit too hastily. And
Right.
yes, we are going back to too soon. It's too soon.
Yeah, you made such a good point there, Nicole, that I want to stay there for a minute, because you said that you could go into a restaurant or go wherever and they take your temperature and your temperature be fine. But then again, last week, or no, yesterday or earlier that day, you had a temperature, or later on that day. So you're saying you could have COVID and your temperature spike up and down, up and down. So even checking your temperature is not foolproof, because just because you don't have a temperature at 242 doesn't mean you didn't have one at 230.
Right.
Is that what you're saying? That's so
exactly
interesting.
what I'm saying. And so it's
So
counterintuitive.
you could still have it and you not have a temperature.
Exactly.
Wow.
So a fever or a temperature is your body's way of dealing with it's an inflammatory response to your body trying to fight the infection, right? And so you don't just stay at peak level inflammatory response the whole time, right? It's going to go up and down. You're going to have ebbs and flows. And so, but you're not going to have the fever the whole time. And so how many times I've seen it before where, my kid had a fever the night before, and then the next morning they wake up and they're fine. It's like, oh, okay, I can send them back to school.
Right.
But then later on that afternoon, they spike another fever, right? Which is why the rules are, even with school and other places, that you need to be 24 hours fever-free, and fever means a temperature over 100.4, 24 hours fever-free without Tylenol or Motrin, right? Or ibuprofen, acetaminophen, whatever, fever reducer, right? Because you're going to see that rise and fall as your body is continuing to fight the infection. So the more infection your body is fighting, the more it kind of flames up. Your immune system goes on 10, and then you spike the fever, and then you either take something or your body's able to go back down. But then guess what? If that virus or whatever your body's fighting flares up again, then your body's going to react to it again. That's why we really need to be waiting at least 72 hours. But I honestly think a week to 7 to 10 days being asymptomatic. And then, like I said, sometimes they're even saying 14 days after your symptoms are gone before you go back out into real world life.
Wow, that's big. That is so interesting, Nicole. That is so interesting. That's so interesting. You could have a fever and not have a fever. You could have it. I mean, you could have the virus and not have a fever, basically.
Yes.
You can have the virus and not have a fever.
Yes. And you can, people.
So even taking your temperature isn't foolproof.
No, it's not. And that's why I don't understand why we're taking people's temperatures before they walk into a building. I'm like, that doesn't tell me anything.
Right.
We don't know if they just took Tylenol or if they took it last night. How do you know? That's so silly to me.
I want to say hi to Paula Bearfield Hughes and Carolyn Penn, both for watching. Thank you, ladies, so much for watching. Anita, I see your question. I'm going to ask it in just a minute after Jennifer's. Jennifer wants to know, do you think they should make wearing face masks mandatory in public places? What do you think, Nicole?
Absolutely. Look at the countries that have gotten their numbers down.
Yes.
Nobody's at zero, But the countries that have gotten the numbers down, it is mandatory that they wear the mask. And again, we keep saying this, the mask is not to protect you from getting the virus. The mask is to protect you from transmitting the virus, right?
Not giving,
so yes, everyone it should be mandatory. I think if we did that, we would see the numbers quickly start to go down, but we're not. And people are so, I'm going to do it because you told me I had to, I'm not going to, right? We're so defiant that's why our numbers keep going up. Yeah.
And I think here in South Carolina, it's kind of chilly, this week, but it's been very warm. And I hear people saying it's so uncomfortable. It's so uncomfortable. And I don't remember if you were on that interview where someone said, is it more uncomfortable to wear a mask or wear a ventilator? What's more
uncomfortable? I was getting ready to say it. Yeah. That's a tube down my throat. I don't want that either. So I'll go ahead and wear my mask.
Anita Pastor says, how are we expected to support open businesses if they don't even require their staff, particularly the cooks, to wear a mask and gloves? She says she's afraid to order pizza.
So how do you support open businesses? You don't. So this is how you support open businesses. You call or you write letters or you petition and say, I noticed that your staff wasn't wearing a mask, so I'm not going to give you my business until you require your staff to wear a mask. If we all did that, then all of the businesses would start requiring them to wear masks.
Right.
And honestly, I probably should have walked out of that ice cream shop since none of their people had on the masks.
Yeah.
There's a business somewhere that is requiring and adhering to that. So that's the way.
But that just brings back to the point with it, and we've spoken on this show to a couple of people from the Accelerate South Carolina Task Force that that should have been, I would think, in the plans for reopening these restaurants. They require them to sanitize the tables and to put the tables 6 feet apart. But I mean, that's another show, girl, because I'm just thinking, what else was in those plans? Were they not required for those employees to wear masks? Especially as the young lady said, Ms. Pastor said, especially those people, Anita Pastor said, especially those folks that are cooking my food, because you're right, Anita, I'm totally exposed.
Right.
So I love pizza too, Anita.
And they're yelling their order from the back and blah, 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 blah. And as you're yelling, they're just, all them germs are just flying all over your food.
All over the place.
Yes.
Yeah, Michelle Keir says, I agree as well. Mandatory masks until we can get a handle on this virus. It's not a matter of fashion. It's a matter of life and death. It definitely is.
Right.
Because we see our numbers going up, not only of those that have contracted it, but deaths.
Dying. Yeah. And then they say only such and such has died. Really? Well, if that was only your family member, would you say that? I don't think you would.
Gwethlyn Barnes says, this is really helping. Thank you. Cassandra Chapman Talmadge says, educate us, Dr. Edwards. All right. Cassandra says, if you tested positive for the antibodies, does that mean that you contracted COVID-19?
Yes, it means that you contracted it at some point. So an antibody is your body's reaction to the virus. And so if you have the antibody, that means at some point you had the virus. And now this is what's kind of left over of your body dealing with the virus. So yes, if you tested positive, it does mean that at some point you contracted it. What we don't know still, we'll probably have to bring Dr. Lexi back on for that one, is how long those antibodies are staying there. Is it 2 weeks? Is it a month? Is it 3 months? We don't know. So just because you have antibodies doesn't mean that you can't contract it again, right? And get a second wave. And I think that's the other problem where we're getting a bit complacent. It's like, oh, I have antibodies, so I'm good. I can't get it again. No, you can't. You can't get it again. And then you can keep spreading it too.
Right. And that's the thing, are you immune to it if you have had it? And a lot of people are thinking that they had it before it was even discovered, so to speak, in the country. I've heard so many people, including me, that said that they had this weird illness in December and January. I mean, I was sick. I did too. I was so sick, and I went from 0 to 100 in no time. That day I was feeling fine, but along the course of the day, I was teaching a class in Timmonsville. On my drive back, I got so fever, just terrible body aches, nausea. And when I did go to the doctor, said, you don't have the flu. You don't have the flu. And he said, I don't know what you have, but I know what you don't have.
Right,
So
right.
I just had to walk it out for a couple of days.
Right. And they were calling it influenza-like illness or upper respiratory infection or viral infection. I have the same thing. I haven't had to use an asthma albuterol inhaler since I was in college when I had exercise-induced asthma. But when I had that back in late January, early February, I had to go get an inhaler because I just felt like something was sitting on my chest and I just kept coughing. But my flu test was negative. Right. Everything else was negative. I don't know what I had.
Dr. Nicole Edwards joins us on Coping with COVID. She's a board-certified family physician here in Columbia, South Carolina. Thank you guys so much for joining us. Please continue to post and share this information out. Carol says, please educate African Americans as we are disappropriately affected. We are. Also, can you address some of the mental health challenges within the African community at this time? We actually had a couple of people on, Carol, talking about that, and we're going to get a couple of more people on. Do you want to tackle that one?
Ooh, there's so much to tackle. So yes, we in the African American community are disproportionately affected, and not just. They talked about it this morning on one of the news stations. They were talking about all of the risk factors, right? And so the problem is that a lot of African Americans have multiple risk factors, whether that mean a poverty level, whether that mean or a socioeconomic level, a lower socioeconomic level, which can mean that there's more people maybe in the house. You don't have enough space to spread out.
Right.
One. The chronic medical conditions are another. The access to healthcare is another. And then just, so we had so many increased risk factors. And so the way that we are then hit with the virus. Is worse, right? Yeah. And so, it is affecting us, African Americans, Hispanics, people of color in general, people who are on a lower socioeconomic status, people who there's more people that you're exposed to, even people like frontline workers. You're not seeing the corporations and the corporate America dealing with it as much. Why? Because they're not having to go back to work. But our people who are working, as delivery drivers or at the pharmacy or at the grocery store or at the Pizza Hut. Those are the people that are on the front lines, and those are the people that are being inundated with it, more exposure, and those are the people that are getting it more. So we are.
There's so many layers to it. Yeah. Hey, Carol, thank you so much for your question. Jennifer Diaby says you're exactly right. No face masks, no business, and I think we should really push that because it is about our health, our well-being. So if they're not, and money talks, the dollar is power. And if you say, I will not patronize your business because your employees are not wearing a face mask, I bet that will turn around. Got to do it. Yeah. Dana Little Walker, thank you so much for joining us, beautiful. She says McMaster doesn't care about the safety of South Carolina residents. She says she's in the upstate taking care of her dad. Both of them wear masks if they have to go out. A lot of the businesses here, the employees are not wearing masks. So it's nationwide, Dana. Thank you for your question. And we hope your dad is good. And God bless you for being able to take care of him. I went, this is so interesting to me, Friday, I think, when our governor, God bless him, ordered another state of emergency and then opened up the bowling alleys.
Oh my goodness. Listen, we are going to have to take matters into our own hands. We cannot rely on anybody else right now in the government. Right now, we have to do this for ourselves, y'all. And we have to almost rally and protest against, take matters into our own hands.
Because here's the other thing, Nicole, as you said before, just because it's open, ladies and gentlemen, don't mean we have to patronize them. Listen, Jennifer, you go to Food Line and get you a pizza, girl, or and doctor it up or whatever. You know what I mean? I just think we really have to just be more conscientious. Thank you guys so much for joining us on Coping with COVID. I tell you, time flies when you're having fun. Dr. Nicole Edwards, board certified family physician. Nicole, if people want to contact you and get more information from you, how can they do that, beautiful?
You can do that. Follow me on all social media platforms or on my website, Dr. Nicole D.O. That's DrNicoleDO. And you can contact me there. You can get in touch with my business, Abundant Life Concierge Medicine, where we provide convenient healthcare for busy professionals and their families. And like I said, all social media platforms. I want people to just be healthy and live their best life.
Yes, absolutely. Nicole is also taking patients. She does telemedicine. So please contact Dr. Nicole Edwards. Please continue to follow me on Facebook also. Please go to the Tailor Made Productions Facebook page, like and follow me there, because we are going to move Coping with COVID to the Tailor Made Productions page. So you'll be able to watch Tailor Made Productions, our Coping with COVID, from the Tailor Made Productions page Monday through Saturday at 2:00. And you can also find all of your COVID related updates. Also follow me on Instagram and YouTube also. Now, if you have a message, a product, or a service that could help someone deal with COVID, please inbox me at Tailor Made Productions or email thetailormadeproductions@gmail.com. And let's talk about how you could also be part of Coping with COVID. Now, tomorrow, we're going to talk with Dr. Linda Bell. She is the state's epidemiologist. She's the sister you've been seeing right there with Governor McMaster's, talking about the South Carolina's treatment and dealing with COVID. So you won't want to miss the show tomorrow. As a matter of fact, if you want to go ahead over to the Tailor Made Productions page and post a question for Dr. Bell, I'll make sure that she answers it tomorrow. So join us tomorrow for Coping with COVID. On Thursday, we're going to get a sports update from WIS TV News sports director Rick Henry. He's going to tell us what's going on with high school and college sports. And what about the NBA? Will we ever get to see another game? And then Friday, Dr. Daniel Lackman with MUSC will talk to us about COVID and high blood pressure and what the deal is with that. As always, I leave with a reading from Jesus Calling. And today is the 16th. And it says, "Stay on the high road with me. Many voices clamor for your attention, trying to divert you to another path. But I have called you to walk closely with me, soaking in my presence, living in my peace. This is my unique design for you. It was planned even before the world began. I have called each of my children to a different path, distinctly designed for you. Don't let anyone convince you that his path is only the right way. And be careful not to exalt your path to superior to another's way. What I require of you is to act justly, to love mercifully, and to walk humbly with me wherever I lead." You can go to JesusCalling.com for more on Jesus Calling, and also go to Dr. Cheryl Williams with Agape Christian Counseling to her Facebook page. I also read from Conversations with God. Thank you guys so much for joining us once again on Coping with COVID. Nicole, always, thank you so much for agreeing to come on and share the information. Anytime I call and text you, I appreciate you so very much. Thank you. Ladies and gentlemen, you take care. Stay well. Be careful. Wear your mask. And we'll see you tomorrow at 2:00 right here with Dr. Linda Bell, state epidemiologist, on Coping with COVID. Have a great one.